Hi everyone, in today's video we are going to explain the drugs used in the treatment of HIV or simply anti-HIV drugs classification. So whenever you are trying to develop an anti-HIV drug, one approach is to inhibit the entry of this HIV to our human cell. Human cell means mainly it is CD4 positive T cell which will be affected by HIV. So the first approach is to prevent the fusion or the entry of this HIV virus to CD4 positive T cell. So those drugs comes under the category called as entry inhibitor or fusion inhibitor. So this is the first class of drug that is called as entry inhibitor or fusion inhibitor. Now the second target is to target an enzyme called as the reverse transcriptase. So whenever you are trying to develop an anti-HIV drug, one approach is to target this enzyme called as reverse transcriptase. So if you can develop a drug which can inhibit this reverse transcriptase enzyme called as the reverse transcriptase inhibitor, that can be used as an anti-HIV drug. Now the third target is to target an enzyme called as integrase. So if you can develop a drug which can inhibit this integrase enzyme, we can develop it as an anti-HIV drug called as the integrase inhibitor. Now the fourth approach or the fourth target is protease enzyme. So if you can develop a drug which can target this enzyme, that is a protease inhibitor category, that can also be used as an anti-HIV drug. So the first approach is to develop an entry inhibitor or a fusion inhibitor. The second class of drugs are reverse transcriptase inhibitor. The third class is integrase inhibitor. The fourth class of drug is protease inhibitor. Now coming to the first class, that is the entry inhibitor or fusion inhibitor. The drugs coming under this category are, one is enfuvirtide. The second example is maraviroc. The third example is monoclonal antibodies. So the mechanism of enfuvirtide is to inhibit a protein in the HIV virus called as glycoprotein 41. So enfuvirtide is a glycoprotein 41 inhibitor, GP41 inhibitor. Now coming to the mechanism of maraviroc, it inhibits the receptor present in this CD4 cell called as CCR5 receptor. So it is a CCR5 receptor inhibitor. So the mechanism of action of maraviroc is it inhibits CCR5 receptor. Now monoclonal antibodies like ibalizumab, one example is ibalizumab. So they mainly target the CD4 T cell receptor, So it inhibits CD4 T cell receptor. So it is a CD4 T cell receptor inhibitor. Okay, so these are the three drugs which important drugs which comes under the entry inhibitor or fusion inhibitor category. Now coming to the second class of drug, that is the reverse transcriptor inhibitor, RTI, abbreviated as RTI, reverse transcriptase inhibitor. They are mainly of two types. One is the competitive reverse transcriptase inhibitor. The second one is non-competitive reverse transcriptor inhibitor. Competitive reverse transcriptor inhibitor is also called as NRTA, which is nothing but nucleoside or nucleotide reverse transcriptase inhibitor. That is called as NRTA. Now non-competitive reverse transcriptor inhibitor belongs to the class called as NNRTA, non-nucleoside reverse transcriptase inhibitor. So this is non-nucleoside reverse transcriptor inhibitor. So reverse transcriptase inhibitor are of two types, NRTA as well as NNRTA. Now let's look into which all the drugs coming under NRTA category, that is nucleoside or nucleotide reverse transcriptase inhibitor. So the drug belonging to nucleoside reverse transcriptor inhibitor are, one is the first anti-HIV drug, that is called as zidovudine. The name ends with VUDANE. Lamivudine, stavudine, zalcitabine, diadenosine, abacavir, emtricitabine. So these are the drugs belonging to nucleoside reverse transcriptase inhibitor. I also told NRT is not only nucleoside, it could be nucleotide also. So the drug coming under nucleotide reverse transcriptor inhibitor is tenofovir. The difference between nucleoside and nucleotide is that nucleotide has an extra phosphate group. Is there, and the drug coming under nucleotide reverse transcriptase inhibitor is tenofovir. Now coming to the NNRTA category, there is a non-competitive inhibitor, non-nucleoside reverse transcriptor inhibitor, which is a non-competitive reverse transcriptor inhibitor. They can be further divided into two classes. That is, one is the first generation NNRTA. There is also second generation NNRTA. The drugs coming under first generation NNRTA are efavirenz, nevirapine, delavirdine, and whereas the drugs coming under second generation category are itravirin. The name ends with virin. Also there are rilpivirin, doravirin. So these three drugs belongs to the second generation non-nucleoside reverse transcriptase inhibitor. So far we have covered two class of drugs. One is the entry inhibitor or fusion inhibitor. We have covered reverse transcriptase inhibitor. Now coming to the third strategy, that is the integrase inhibitor. The drugs coming under this category ends with the gravir, tegravir, tegravir. The name ends with tegravir. Examples are raltegravir, LV-tegravir. So these are the two important drugs coming under integrase inhibitor category. Now coming to the last class, that is the protease inhibitor category. The fourth one. This was the third one. Now coming to the last class, that is the protease inhibitor category. The name of this drug ends with navir, Navir. Navir drugs. So the examples are ritonavir, lopinavir, ambrinavir, fosambrinavir, atazanavir, sacuinavir, nelfinavir, indinavir, darunavir, tipranavir. So all these drugs ends with the name navir, and these are the drugs belonging to the protease inhibitor category. So we have covered all this four classes of drugs. Now to summarize, this is the summary of this entire anti-HIV drug category. We have told about the fusion inhibitors. The drugs coming under the category are enfuvirtide, maraviroc, and the monoclonal antibody ibalizumab. We have also targeted the reverse transcriptase enzyme. They are of two types, NRTA and NNRTA. NRTA are of two types, nucleoside as well as nucleotide reverse transcriptase inhibitor. The drugs coming under nucleoside reverse transcriptase inhibitor are zidovudine, lamivudine, stavudine, diadenosine, zalcitabine, abacavir, emtricitabine. The drug coming under nucleotide reverse transcriptase inhibitor is tenofovir. Now coming to the NNRTA category, they are of two types, first generation, second generation. First generations are of efavirenz, nevirapine and dilaverdin. Efavirenz, nevirapine, dilaverdin. The second generation NNRT are itravirin, rilpivirin and doravirin. Now the third target was to inhibit the integrase enzyme, that is the integrase inhibitor. The name ends with tigravir. The examples are raltigravir, LV-tigravir. Now coming to the last category, that is a protease inhibitor. The name ends with navir. The examples are ritonavir, lopinavir, ambrinavir, fosambrinavir, atazanavir, saculavir, nelfinavir, indinavir, darunavir and tipranavir. So this is the summary of the entire anti-HIV drugs classification. Hope you understood this video, and thanks for watching. Keep on watching our video. Thank you so much.